Van Vleck House provides 3 different branches within the Van Vleck House. There's court diversion programs for first-time offenders going into circuit court. There's the crisis shelter, which is the Adams Canyon Crisis Shelter. That's short-term stay for kids and families that are having trouble with each other. It gives a short stay for the families to settle and to make a case plan of how they're going to improve their situation. And then the group home is for more long-term court-placed kids having emotional and behavioral difficulties. Hirschfield Center is a child advocacy center. It provides forensic interviews for alleged cases of child abuse. It does family advocate program for families at risk of abuse to provide services to reduce that risk of abuse. And it provides also prevention programs for community, for any kids in the community to just help improve relationships with other kids. Red Top provides residential treatment for adolescent boys from around the state that are court ordered into the program, boys that have issues with emotional, behavioral, mental health issues. Other options, the boys' school, which is the state prison for boys. There are other treatment centers, more traditional settings, and there's also psychiatric facilities or hospitals. I think the overall common theme of what we do in everything is about relationships and helping kids and families develop relationships. The challenge of the finances is very few of any of the programs we have, whether it be at Red Top or the group home or the crisis shelter, the Hirschfield Center, any of them. There are very few pieces that are funded completely. The per diem that gets paid pays maybe 2/3, 3/4 of what the actual cost is, and we have to make up the difference. The Hirschfield Center work in doing forensic interviews and the family advocate work, there's no consistent funding for. So every year we need to find, or every few years, a new grant. We have to get donations for it. Almost all of our programs we have to subsidize with donations. The state's conservative on addressing social service issues in general, and feel that people have a lot of responsibility to take care of those things themselves. Part of the issue we try to make clear is that if kids are having issues and troubles with mistrusting people, have issues about building relationships, that's not going away. They're just going to get transferred and showed up somewhere else, and whether that's going to be in the criminal justice system or it's going to be in hospitalizations or psychiatric placements or somewhere, they're going to show up. And it'll continue to be it's going to be a burden one way or the other. It's hard to show data of how prevention or things you've done have saved somebody money. You know, I mean, that's hard to show. I mean, I understand that people want to see that the legislators or whoever gives money wants to see that their money is having a result. And we can show what service they buy with that and what that service does, but it's hard to show what would happen if you didn't provide that service and what the cost would be if you hadn't provided it. We have a strong belief if you don't provide it, the costs are going to be much greater long term than what our services are costing. In the very end of June last year, of a student in the group home committing suicide, over and above and beyond our control and what all we'd done to prevent that, but it happened. We understandably were investigated on how that could happen and eventually cleared of being negligent or doing anything wrong. But that process took some time, and so for a period of time, our group home facility was not open. And for those months that we were not open, the number of placements, the number of juveniles showing up presenting in the emergency room at the hospital went from usually having like 3 or 4 in the course of the year to there were 16 young people that showed up in the ER between July 1st and midway through November. We reopened end of October, mid of October, and those numbers have gone down since. It's still not as low as it was prior, but have been reduced dramatically. It did point out the value of the service in terms of, I think, for law enforcement, for parents, for the mental health center, for the hospital, to see that there's a gap when we disappear. And I think everybody knew that, was aware of it, but it was really felt and seen with us being gone. You know, I think when you have a continuum of care and a system, we're very fortunate to work in a community where people work together well, and I think there aren't a great deal of services around the state, but I think Teton County does a good job of working together to provide services. But if you take a piece, and we've worked hard to make sure it's a continuum and not in each other's way, and when you take a piece out, there's a hole, and things don't function, and that's what happened for us and for the community. Our occupancy being full is 14, and for a number of years we were close to full all the time. I would say our average occupancy in the course of a year was 13. That number dropped to probably 2 years ago to more around 10, and this past year our occupancy rate's been more like at a number of 8. The Department of Family Services has been the primary placement authority, or the group primarily that makes the referrals to us, or court ordered, and it goes through the Department of Family Services, has made a concerted effort to reduce out-of-home placements or to reduce placements in residential treatment centers. They're basing that on saying that kids are better served, one, with short lengths of stay, that 4 months, 3 months, is as long a time as a kid should be in residential treatment, and after that, results diminish. The data and studies I have don't verify that, but I understand financially they wish that was true. I think length of stay and length of treatment for a kid here at Red Top probably is 4 months once they're ready to get to work, but they probably spend 4, 5, 6 months getting ready to actually do the work. So you have to get past that resistance in that time to get around to working. I think what would make a difference in terms of, we can take placements here from continuing to be from court-ordered placements, and I think having advocates to legislators, to courts, to county attorneys, to people across the state that see kids, that advocates that speak up that residential treatment is a positive treatment option. That Red Top Meadows is a very unique, and I think a unique niche within the state, and provides a unique treatment option to the state that, if we were to disappear, would not be replaced anywhere. Our programs are based on relationships, and relationships require, it means staff to student. So salaries are the primary thing, and 80% of our budget goes to salaries and benefits. Our staff are underpaid for any work, but certainly for the dedication that they show and the hard work they do, they're underpaid. They need to be paid a better rate to retain them, keep them to be able to live in this area. Our facilities are always needing improvement, and we're always in need of vehicles. Some people turn vehicles over every few years, and a few-year-old vehicle for us would be brand new. The state pays us anywhere from, and it's varied time to time, anywhere from 60 to 80% of what our actual cost is, particularly like for Red Top Meadows or for the crisis shelter or the group home. They've never told us why there's a percentage. if you know it costs this amount, if you know it costs $180 a day to provide the service, why is it okay you're only paying $160? Okay, I mean, you go through a process of having, the juvenile justice system is full of confidentiality requirements, and then, but if you're an offender, we notify all the schools, all the neighbors, all the public, all the clubs, so nothing's confidential. And the vast majority of kids that go through treatment never reoffend. Vast majority, like 95%, 97%. For somebody who's needing help, who maybe has heard of us but not sure where or how to get involved, the first thing and simplest thing I'd say is pick up the phone and call us, okay? You can call Red Top Meadows at 733-9098. You can call the Van Vleck House office at 733-6440. And whoever you get on the phone will help you find the right person to talk to and help direct you where you can get the help. You can go to our website at tyfs.org and look at what all the programs are, send an email, make a phone call. We'll help you figure out where to get started and which part can help most. Yeah, it's important for people also to understand that those services are free. We will never deny service to somebody over a cost or a payment. And so call us and we'll find you the help you need. And I think I want people to know and understand that it's about relationships. And what I mean by that is that relationships in people's lives is a primary factor of the quality of a person's life. That our culture spends all sorts of time educating people so they have income and they have money and they can have stuff, but we don't do a great job of helping people learn about relationships and having those, and that's far more important in terms of the quality of somebody's life. And everything that we do in the agency is geared towards helping children and families gain those skills and gain that trust and build those relationships so they can have successful and constructive lives and a quality of life that's rich and meaningful for them.